What if I told you that the number on that little blood pressure cuff could be quietly deciding whether you remember your grandchildren's names 10 years from now? Not whether you'll have a heart attack, not whether you'll have a stroke, but whether, one ordinary Tuesday morning, you'll look across the breakfast table at the person you've loved for 40 years and feel nothing. No recognition. Just silence. If that image scares you, good. It should. Because right now, there is a crisis unfolding in tens of millions of American homes, and most people have no idea it's happening to them. Stay with me for the next few minutes, because what you're about to learn is backed by the latest science from Harvard, Johns Hopkins, and the American Heart Association, and it may be the most important thing you watch this year. You've heard high blood pressure called the silent killer. You've heard that for years. Maybe your doctor has mentioned it. Maybe you're even on medication for it right now. But here's what most people, even many doctors, haven't fully connected yet. High blood pressure doesn't just attack your heart. It attacks your brain. Think of the tiny blood vessels inside your brain. Microscopic, fragile. They look like spider silk under a microscope, carrying oxygen, nutrients, life itself to every memory you've ever made, every word you know, every face you love. Now imagine a fire hose, pumping at full pressure, day after day, week after week, year after year. That is what uncontrolled high blood pressure does to those spider silk vessels in your brain. It thickens them, scars them, hardens them, and eventually, silently, it begins to starve your brain of what it needs to function. According to the American Heart Association's own 2025 guidelines, brand new guidelines released just last October, leaving high blood pressure unchecked doesn't just raise your it significantly raises your risk of both dementia and cognitive decline. The AHA put it simply: if you have high blood pressure, lowering it now may help protect your brain health in the future. Now, that sounds like good news, and in a moment, I'm going to tell you exactly how to use it. But first, I need to tell you about something far more alarming, something happening right now in 2026 that affects hundreds of thousands of Americans who think they're already protected. In late 2025 and into early 2026, the FDA began recalling multiple blood pressure medications due to contamination with cancer-causing chemicals called nitrosamines. Over 580,000 blood pressure capsules of a drug called prazosin, taken by more than 500,000 patients every single year, were pulled from shelves after elevated levels of these cancer-linked chemicals were found. And that wasn't the only one. In January 2026, another blood pressure drug, bisoprolol, combined with hydrochlorothiazide, was recalled after problems emerged at the manufacturing facility. Now, I want to be very clear. Please do not stop taking your blood pressure medication without talking to your doctor. That could be far more dangerous. But you deserve to know this is happening. Here's what makes this even more troubling. A 2025 study, the first of its kind, managed to link specific drug lots back to their manufacturing origins. And what they found was chilling. Generic blood pressure drugs manufactured overseas carried a 54% higher risk of serious adverse events compared to the same drugs made in the United States. 54%. So what do you do with that information? You become your own advocate. You look at the bottle in your medicine cabinet. You check the label for where your medication was manufactured. You call your pharmacist and ask, and if you have any concerns, you bring them to your doctor. Knowledge is not fear. Knowledge is power. Now let me bring you some genuinely good news, because there is good news. In October 2025, the American Heart Association and the American College of Cardiology released their most comprehensive blood pressure guidelines in 8 years. And these guidelines contain information that every single person over 60 needs to understand. The target is clear. Your blood pressure should be below 130 over 80, not 140, not 150, 130 over 80. Why does 10 points matter? Let me give you the numbers directly from the research. For every 10 points you drop your top number, your systolic pressure, you reduce your risk of coronary heart disease by 17%, stroke by 27%, heart failure by 28%, and all-cause mortality, your overall risk of dying, by 13%. Every single point matters. But here's what the new guidelines did that is especially important for those of us over 65. Under the old rules, the 2017 guidelines, if you were 65 or older with any elevation in blood pressure, your doctor would almost automatically put you on medication. Age alone was enough. The new 2025 guidelines changed that. Now, treatment is risk-based. Instead of age triggering a prescription, your doctor should now be using a calculator called the PREVENT equation to look at your individual 10-year risk of cardiovascular disease, taking into account your weight, your kidney function, your cholesterol, and other personal factors. What does this mean for you? It means a conversation. It means you should be sitting down with your doctor and asking, based on these new guidelines, is my treatment still the right one for me? Now, this is the part of the video I need you to hear most closely, because what science has discovered in the last 2 years about blood pressure and your brain is nothing short of extraordinary. In April 2025, a landmark study was published in the prestigious journal Nature Medicine. Researchers followed nearly 34,000 people with uncontrolled high blood pressure, and they found that intensively controlling blood pressure cut the risk of dementia by 15%. 15% fewer people losing their memories. 15% fewer families watching someone they love disappear while still physically present. And just 2 months ago, in February 2026, researchers at Kaiser Permanente published a study in JAMA Network Open, examining actual brain autopsies of people who had taken blood pressure medication for 15 years or more. What they found gave scientists real hope for the first time. People who had taken certain blood pressure medications long-term showed a 24% lower risk of the kind of tiny artery damage in the brain that causes vascular dementia. And lower levels of tau protein, the toxic protein linked to Alzheimer's disease. Do you understand what that means? The pill you may already be taking, if you're taking the right one, consistently, may be building a shield around your brain right now. The researchers at Johns Hopkins found something similar, that people taking antihypertensive medication reduced their risk of developing dementia by about 1/3. One particular class of medication, potassium-sparing diuretics, reduced Alzheimer's risk by nearly 75% in one study. Now, I want to be clear. Science is still working to fully understand exactly how and why this protection works. But the direction of the evidence is unmistakable. Controlling your blood pressure may be one of the single most powerful things you can do to protect your mind. So let's make this real. Let's talk about what you can do, starting today. Not someday, not next year, today. Number 1. Know your number. If you haven't checked your blood pressure recently, do it this week. Not next month, this week. Your pharmacy has a free machine. A home monitor costs less than $30. The target? Below 130/80. Write it down. Number 2. Ask your doctor about the new guidelines. Tell them you've heard about the 2025 AHA blood pressure guidelines. Ask them, has my treatment plan been updated to reflect the new risk-based approach? Ask whether the PREVENT calculator has been used to evaluate your individual risk. You have the right to ask these questions. Number 3. Check your medications. Look at the bottles in your medicine cabinet. Note where your blood pressure medication is manufactured. If you see a manufacturer you don't recognize or a label showing production overseas, ask your pharmacist if there are US-made alternatives. This is not alarmism. This is smart self-advocacy. Number 4. Move your body, even a little. The new guidelines are clear that lifestyle changes are the first line of defense. 30 minutes of gentle walking most days can lower your systolic pressure by 4 to 9 points on its own. That's the same as many medications. The AHA recommends reducing sodium, no more than 2,300 milligrams per day, and eating a diet rich in fruits, vegetables, and whole grains. Number 5. Don't tolerate fluctuating blood pressure. This is something many people don't know. It's not just high blood pressure that damages your brain. It's unstable blood pressure, numbers that swing up and down from one week to the next. A 2023 study published in JAMA Network Open found that year-to-year variability in blood pressure was linked to a dramatically higher lifetime risk of dementia. Consistency matters. Every day. I want to leave you with something. I know that getting older in America can feel frightening sometimes. The medical system is complicated. The news is overwhelming. And it sometimes feels like, no matter how hard you try, there's always something new to worry about. But here is what I want you to hold on to today. Science is on your side. The research is clearer now than it has ever been that the choices you make about your medications, about your diet, about how often you get up and take a walk, are not small choices. They are the choices that keep you present, sharp, at the table, in the room, in the story of your family's life.
Your brain is worth fighting for, and you are not alone in that fight. If this video gave you something valuable today, please share it with someone you love, a spouse, a sibling, a friend who never quite got around to checking their blood pressure. Subscribe to Health After 60 if you haven't already.
And leave a comment below. Tell me, what number do you see on your blood pressure monitor? I read every single one. Take care of yourself, and I'll see you in the next one.